Heartworm disease in dogs. It's a potentially very serious disease which sounds more than ominous. One of the more common questions I had in veterinary practice was whether or not, your dog should be on a conventional heartworm preventive. In this video, you're going to learn about heartworm, the common causes of heartworm, the clinical signs associated with heartworm, then more importantly, whether or not your dog needs to be on a conventional heartworm preventive, and then some of the holistic options. Heartworm disease in dogs, the conventional myths and holistic options. So what is heartworm? Heartworm, or Dirofilaria immitis, is a parasitic worm which infects mostly dogs. Pictured here is a dog's heart filled with heartworms. The worm mainly affects the lung arteries, and clinical signs are associated with damage to the lungs and then the heart. Heartworm is spread by mosquitoes. Not all mosquitoes carry heartworm, but when an infected mosquito bites your pet, it can transfer larvae to your dog's tissues. The worms require development in the mosquito at temperatures above 80 degrees Fahrenheit. When it's below 57 degrees Fahrenheit, development can occur and the cycle will be halted. If the temperature is warm enough and the heartworm larvae progresses to being infective, then they can infect another dog. The larvae then migrate through the body until they reach the animal's heart and lungs. There the adult worms will grow. They can grow to 70 to 110 centimeters long and cause a great deal of damage to the heart and the lungs. Clinical signs. Dogs show no sign of infection with heartworm during the first 6 months. The first signs include a cough, especially after exercise. As the disease advances, signs can include fainting, pronounced coughing, weakness or syncope, crackles in the lungs, a general overall weakness, and heart failure. In serious cases of heartworm, it can lead to sudden death. This X-ray here, the bottom one, shows an increasing white opacity in the lungs, and that's what you would see with fluid in heart disease or heartworm disease. So what are your solutions? What are the options? Most, but not all, holistic veterinarians consider the use of pharmaceutical preventives to be less harmful than a heartworm infection. What you need to be aware of is the incidence of heartworm in your area and whether or not your pet really is at risk of heartworm disease. For example, in Canada, heartworm is difficult to acquire and usually not fatal. No question, it's far less dire than the warnings and marketing claims of the heartworm preventive companies. For heartworm to be transmitted to your pet, you need to be the correct temperature for a long enough period of time. It needs to be the right climate, the correct species and sex of mosquito. Holistic heartworm preventive options include many common sense natural health suggestions to keep your dog's immune system healthy, along with preventing mosquito bites. First, avoid unnecessary vaccines. Keep your dog's immune system healthy. Avoid repeated use of steroids or conventional antibiotics. Provide excellent nutrition by feeding quality natural brands of dog food, home diets, and some raw food. Ensure that the diet includes certain nutraceuticals that help prime the immune response, essential fatty acids in adequate levels, probiotics, and consider the use of colostrum. And all of those nutraceuticals are in my supplement, Ultimate Canine Health Formula. Practice excellent mosquito control, for this is the insect that spreads heartworm. I've had some great success using a natural mosquito repellent, which uses cedarwood oil. Use natural alternatives whenever possible. This can mean using no-sodes and herbal supplements while also having your dog tested for heartworm. Obviously, this is better under the guidance of a holistic veterinarian. Conventional use of monthly heartworm preventives. If you're in a high-risk area, you're going to need to use the conventional preventives, but use them for as short a duration as possible, such as when the conditions really exist to transmit the disease, meaning when it's warm enough and there's mosquitoes present that can actually transmit it to your dog. Use the lowest effective dose of the preventives, and you can also follow up the conventional medications with liver supportive products, such as milk thistle and vitamin E. And if you live in an area with little to no risk of heartworm, consider no use of conventional medication, and that's what I do with my own dog here. Thank you for watching this week's edition of Veterinary Secrets. What I want you to do right now is click the link, that link in the box below, and I'll be sending you my free book and videos on how to heal your pets at home with my top natural